This is Reframe, the podcast from the College of Education, Health, and Society on the campus of Miami University in Oxford, Ohio. Electronic cigarettes are spreading like a wave across this country. Just 3 years after hitting the market, e-cigarettes are being used by teenagers almost everywhere. Even the FDA has recently called it an epidemic.
They're being used at just astronomical rates among youth.
So in this episode, we'll speak more with Dr. Lauren Bartoszek, Miami University Visiting Assistant Professor of Public Health. And we'll hear more about important information that parents and teachers should know and how we might stop the momentum of this growing phenomena.
I think when you said phenomena, that really is truly what it is. It started on the West Coast, and right around 2015 is when it sparked the interest of the many youngins out on the West Coast. And that was just in 2015. I mean, we're only 3 years past that. So it's made its way across the nation. There have been reports from the West Coast, and then it hit to like the Texas Central Plains area, and then it kind of hit to the East Coast, and then to the South, and then really recently up to the Northeast. So it just sort of, the wave kind of happened across the nation, but so quickly.
Dr. Bartoszek is among the many public health professionals moving quickly to address this problem now, because in a lot of ways, their concerns are very valid. According to the U.S. Surgeon General, e-cigarettes, or also known as E-Cigs or vaping, are now the most commonly used form of tobacco by youth in the United States. They use a battery-operated electronic nicotine delivery system to inhale a vaporized aerosol, and data shows that more than 40% of high schoolers have used e-cigarettes at least once. Over 15% of youth have reported ongoing use in the past 30 days, and in some areas, that number is approaching 20%. And when compared to 2017, usage is up 78% among high schoolers and nearly 50% among middle schoolers just this year alone. And many public health professionals believe it will only get worse before it gets better. In a time when the battle against smoking has largely been won, it's surprising to see yet another nicotine threat emerge so quickly, especially one that can be so alluring to some and yet so mysterious to others. So Dr. Bartoszek, do a lot of people not yet know what vaping or e-cigarettes are? Is this still a mysterious issue to some? Like maybe especially to parents and teachers who may be thinking, what are kids doing now?
Yes, 100%. So as you kind of think about like the traditional cigarette sort of was the initial, and then you've got those large scale vaping units that billow the smoke out. And so everyone knows what that is 'cause it's really easy to see. But the newest ones are these really super sleek electronic devices that charge in a USB drive, literally, not figuratively, like literally charge in a USB drive. And so teachers and parents may not recognize it. I actually heard a kind of an anecdote, a story a couple of weeks ago about how kids at a school, and I don't have any, it was just like kind of through a friend, oh my God, I heard this, that kids were sort of starting to play like a game, like seeing which teachers they could get to charge their e-cig for them. Like, hey, can you charge my USB? Which, I don't know, I mean, if you just don't know much about it, sure thing, I'll plug it in. And the kids were kind of like playing a game, like which teachers they could get to charge their e-cig for them, because you just don't know. So as far as what teachers and parents should look for, I mean, the device itself is really the number one thing, like trying to start, Googling and recognizing, go into vape shops, go into stores and start looking at what the devices look like so that you can recognize what it is. The other thing is just the simple fact that it does charge in a USB. So, not trying to call out students necessarily, right? You don't want to assume that that's what it is, but knowing that it could be, right? So it's just a matter of education. I mean, this is going to be health education at its finest for both parents, teachers, professionals, and our youth in terms of what to do.
Do you have a sense on why electronic cigarettes are becoming so popular among teenagers today? I even saw a report, an article in U.S. News and World Report that called it the mark of teenage coolness that's developed a cult following among adolescents. Now, I imagine part of that feeling of being able to get away with something must be part of it, but that can't be the whole story, right?
Yeah, I think it pretty much can be locked into about three things. The first would be that kids nowadays, this generation, they don't smoke cigarettes. Most of them will say, ew. We have done, as prevention measures, have done a great job of saying cigarettes are bad, cigarettes are bad, cigarettes are bad. The problem with that is just the one word, cigarettes. So what that immediately signifies is that if it's not a cigarette, well, then it can't be bad. The problem, cigarettes are bad. That's true. Nicotine, though, is also bad. It is a toxic substance. And so I think the first thing is that e-cigarettes have claimed to be, and there's a huge thought process that they are healthier or not harmful. The hard part from a public health standpoint is that the fact is they are safer than cigarettes. Well, yeah, you're not inhaling smoke. So the tar and like the actual blackened lung thing, from what we know, is not there because you're not inhaling smoke. So true, they are safer, but
Right. I've heard the saying that saying it's safer than cigarettes is not setting the bar very high.
Right. And so that becomes a really big problem. So this perception of harm is really low. The second thing is the perception about risk of dependence and addiction. A lot of studies have, particularly in talking to younger kids, a lot of them don't think that nicotine are in some of the products. Oh, this doesn't have nicotine, it's just flavored water vapor. About 99% of products tested have nicotine in them, even ones that say 0% nicotine. So that's just completely unprecedented. But they don't think, generally speaking, that they're harmful. They don't think that there's a high addiction potential. The third thing really comes down to the fact that E-Cigs are cool. They are flavors. French vanilla, cherry pie, right? Like kiwi strawberry. They're literally on billboards and websites and magazines that have celebrities, concerts, all the traditional, if you think back to like before the 1998 Master Settlement Agreement, which was where Big Tobacco basically got called out. One of the biggest things apart in that agreement was that cigarette marketing couldn't be towards youth anymore. So no flavors, no TV ads, no youth appealing things. So that's why you don't see cigarettes like that. Electronic products were not a part of that piece of legislation because they didn't really exist, right? So they kind of fall into that quote loophole of they're allowed to do that type of marketing. That's really the third thing, is that they are 100% marketed. And when you read on the websites, all these big companies will say things like, these are meant for adult smokers. Adults want flavors too, but I'm going to be honest, again, anecdotally, but the few adults that I've spoken to that use E-Cigs say, no, I don't want flavors because I want it to taste poorly because I want to quit completely. But kids, it's the opposite, right? Like, it tastes good. It's cool. It's sleek. Everyone's doing it. There's just this general perception that if we don't know the outcomes are bad, it must be good.
So do we know how dangerous they are or even potentially could be?
Yes. So with the ever so lovely spike in the last handful of years, immediately the CDC and the FDA have started to do some really interesting studies. While we don't know completely what's in the aerosol, like as far as the ingredients, we know that there are carcinogenic materials, there's heavy metals that have been found to be in that aerosol, nicotine, which in itself is just a problem in a variety of ways, which I can talk about here in a second, as well as the flavor. So the problem with the flavor is that the flavorings are approved by the FDA for ingestion, which means that the stomach can handle them. The stomach has acid. The lungs, however, are not the stomach, right? And so that's where it gets really gray for, I think, kids and for some people, is that the flavors that oftentimes are used in these E-Cigs, I don't know if you heard about popcorn lung. Have you ever heard about that?
No.
So there was a case maybe or two of people using e-cigarettes getting something that they were calling popcorn lung, okay? And scientifically, I haven't done my full-fledged biological research on like what's happening, but it's something with like the bronchioles in the lungs, like all the little parts of that help you breathe in your lungs. They call it popcorn lung though, because the only other place that they've seen this health outcome was in people who worked in factories that made popcorn, that were inhaling the fake butter. So again, fake butter is totally okay for your stomach, but when you inhale it, your lungs cannot process that. So there haven't been a ton of health outcomes. Like, that's only been a handful of cases that I can even think about in the news, but that's one of them. And the reason we don't have a ton is because, again, this really was 2015. It's been 3 years. It took us 22 years, well, actually, about 50 years since the first time we said cigarettes cause lung cancer back in the 50s, to really have like a firm body of research. So we're trying to fit in the last 3 to 5 years, right? Like all this stuff. So there haven't been any super big long-term studies, but the few that there are, the health outcomes are not great. The stuff that we've found. Really quickly on nicotine, what I don't think people know is how toxic it truly is. So nicotine, when inhaled and like when used in a cigarette, gives you that buzz, gives you that short-term kind of like quick onset like feeling of intoxication, but you're typically taking on in very small amounts, right, in the cigarette. The way that the E-Cig works is something called a nicotine salt, and what it does is it creates a smoother inhalation, right? But the problem is it's so concentrated that the porous skin, it can actually be toxic. So there was actually a story of, I want to say it was like Wisconsin or Minnesota, where a school administrator had confiscated an electronic product and had gotten some on his skin and actually was rushed to the hospital. So there's a slew of other problems, like from exposure to the skin, that can be super toxic, all the way up to, potentially fatal depending on the dose.
So these problems seem like they're all part of a growing list of bad news, but it also seems like there's good news too. There's a strong resistance that seems to be rising, like there's already massive efforts underway to curb these new trends. It's encouraging to see how the CDC, for example, is already on this so quickly. So do we not necessarily have to relearn all the hard lessons that we learned in the past with cigarettes all over again? Like, it took a while for people to wake up and realize those were bad, but now it seems like we don't have to wait 20 years to do that. People can use what we learned back then to mobilize quickly now before it becomes a problem at that scale.
And I think that that's exactly true, right? Like, we have all of this really amazing information from cigarettes, and we don't necessarily need to reinvent the wheel in terms of prevention, because all we need to do is just reframe it, right? We've got prevention cigarette messaging down, and we have results over the last 20 years that show it worked, right? Like, it worked. So how can we take that same structure and change it to E-Cigs? And actually, I just saw, for the very first time, a commercial this weekend about juuling. It was the first one I've ever seen. And what's great is that they just really use the same tactics that they've used and just change the product.
Juuling is actually a reference to Juul Labs, the dominant e-cigarette manufacturer. And while the CDC continues to conduct in-depth medical research, the FDA has cracked down hard on Juul Labs. Alongside an aggressive scrutiny of marketing and advertising practices and more, the FDA just enacted expansive new anti-tobacco measures aimed prominently at underage vaping. Soon the FDA also plans to ban flavored e-cigarette sales in stores, and additional efforts are also coalescing in local communities all around the nation. At Miami, Lauren Bartoszek, along with her research colleagues Rosemary Ward, Philip Smith, and Paul Branscombe, have received funding to examine e-cigarette use among college students, and Bartoszek also serves as the advocacy coordinator for Activating Substance Abuse Prevention, or ASAP, a coalition in Norwood, Ohio, which recently acquired $75,000 from Interact for Health to support a policy called Tobacco 21. Tobacco 21 is designed to help local citizens push back against the spread of e-cigarettes and other tobacco-related products. The goal is to raise the age required to purchase such products from 18 to 21.
This Tobacco 21 is really beautiful because it is local, right? The government is, in terms of FDA and CDC, are doing their due diligence. They're doing all that scientific work that we need to say, like, this is bad, here's what's in it. But until we get a blanket policy, it's got to come from below, which is pretty awesome to hear that people could actually change this. You can go do it, which is really, really great.
The policy is now active in over 360 cities across the country. In Ohio, Cleveland, and Columbus have already passed Tobacco 21, and support is building in the Cincinnati and Oxford areas. As a community-led ordinance, it only takes a local city council vote to pass, so health professionals strongly encourage local residents to get involved, and supporting Tobacco 21 is a great way to begin. But there are a few more things that people can do.
I think the two main things is if, number one, people should just start doing their research. I mean, there are some amazing fact sheets and amazing informational tools from the Surgeon General. They did an entire report. It's hundreds of pages long, so they have fact sheets for it. The CDC, the FDA, right? Like, know the truth. And the truth is that they are a safer option, but they are not an FDA-approved cessation tool. They are not safe, and they are very unknown, right? There's a lot we still don't know about them.
And number two, parents should talk to their children about e-cigarettes.
It kind of stems to more of that broad spectrum substance abuse prevention. This is a lot of high school kids who are really under their parents' roof still. So just encouraging parents to ask their kids, right, in a non-judgmental, open conversation, like, hey, who does E-Cigs? I mean, like, do you know what it is? Do you know if it's good for you? And we find typically, and the research suggests that, right, like, better parent-child communication tends to lend itself to being a protective factor. So kids are less likely to report using drugs of any kind. So really trying to just keep an open line of communication, as opposed to looking for something, trying to like find their source, just trying to ask, trying to say, hey, this E-Cig thing is really taking over. So just really start basic questions because it doesn't look or smell like a cigarette.
All right. Well, thank you so much for speaking about this topic today and for all the great information.
Thank you so much. Yeah, I could talk about this all day. So if you have any other questions, don't hesitate to ask because they are so new and so sneaky.
Dr. Lauren Bartoszek is a Miami University visiting assistant professor of public health, and if you do have any questions or if you'd like more information, you can email us at reframe@miamioh.edu. And thank you for listening.